Hi, I'm Michele Alaniz, and I'm the director of the pediatrics department at Casa Colina's Children's Services Center. Here we work with kids of all sorts of ages, all the way from birth until they're 23 years old. And we're helping them learn to do new and exciting skills that's important to them and that's important to their families. We provide OT, PT, speech, and group programs too. And today we're going to be talking about sensory integration. So what is sensory integration? Well, it's a couple of things really. First of all, it's something that our brains do to help make sense of all of the sensory input that we get as we're moving through the world. So it's how we make sense of the sounds and the touches and the movement that we experience as we go through our days. So sensory integration is a function of our brains, but it's also a theory in occupational therapy. A theory means it's something that guides our intervention. It's something that informs how we work with your child. So in the theory of sensory integration, we're looking at children that are having problems processing sensory input. Maybe they're too sensitive to sound or touch, or they're just having a hard time with developing motor skills or other things like that. And we identify that they have a problem with processing sensory information. When that's the case, we might use this framework called sensory integration therapy. And that's where we're using all of these specialized equipment that looks like swings and trampolines and fun things to be a part of. And we're targeting that neurological process of sensory integration. So those are the two things that we're referring to when we say sensory integration. Now, what do you need to know? First of all, you need to know that we have a lot of different senses. Everyone's familiar with the 5 common ones: your smell, your touch, your hearing, all of those things. But when we're talking about sensory integration in therapy, we're really looking at 3 senses that are maybe a little more hidden. We'll start out by talking about the vestibular system. The vestibular system is your sense of movement and gravity. It tells you where you are in space. And then we also look at proprioception. That's your understanding of where your muscles and your joints are without even looking. So right now, without even looking, you know exactly where your feet are. You know exactly where your hands are. That's your proprioception. And then finally, we look at tactile processing. That's, of course, the sense of touch, pain, temperature, pressure. But today, we're really going to focus on the vestibular system. Okay, so the vestibular system is our sense of movement and of gravity, and the sensors for the vestibular system are actually in our inner ear. That's why sometimes we find with kids, if they've had chronic ear infections at a young age, they'll have problems with their vestibular system. Or maybe as an adult, you've had a situation where you've gotten vertigo, where you're feeling dizzy. That's a problem with your vestibular system. The vestibular system is housed in the inner ear, and it registers all sorts of movement. So first of all, let's talk about rotary input. That's what you get when you nod your head yes, like, yes, I'll definitely have another cup of coffee. Or when you nod your head no, like, no, I'm so high strung right now, I don't need any coffee. And it also registers head tilt like this, which is like the one yoga move that I can nail every time. So the vestibular system registers this rotary input. It also registers linear input. So that's like when you're jumping up and down on a trampoline or you're going back and forth on a swing. Those are all linear inputs. Finally, the vestibular system registers gravity. That's helping us know where we are in relation to the ground. So our feet off of the ground, is our head tilted backwards? Are we falling off balance? That's how the vestibular system helps us with those things. Now, why does any of that matter? Well, the vestibular system contributes to the development of a lot of really important skills. The first one is balance. So our vestibular system is what keeps us upright. If you trip and suddenly you're able to adjust and catch your balance, that's your vestibular system working for you. Sometimes it doesn't work out, but most of the time it does. And when we're looking at balance, there's both static balance, which is your ability to just stand still and not fall over, stand on one foot and not fall over. And there's dynamic balance, which is when you're moving through space. One thing that we find with children that have problems with their vestibular system is that sometimes their dynamic balance is pretty good. They're running around, they're jumping on things, they're able to keep their balance. But when it comes to staying still, that's where it falls apart for them. And that's because they're not getting all that movement feeding their vestibular system, because remember, the brain is registering that movement. And so when they're static, they have less sensory input, and that's where they start to struggle with their balance. Another really important function of the vestibular system is it helps to modulate our arousal. Now, that's just a fancy way of saying, like, what is our level of alertness? So we'll find for kids that have a vestibular problem, sometimes they're really overly active. They're the kids that are all over the place, jumping and running and always on the move. The parents will describe them as constantly on the move. And that's because their vestibular system is craving that movement input because it's not processing the information that effectively. And so it's seeking out more and more and more to try to like get what it needs. Or you might see on the flip side, if a child is maybe a little bit too sensitive to vestibular input, that they avoid movement. So they're kind of a lump on a log. And on top of all of those things, we know that just moving is stimulating to our nervous system. So if you're in a meeting and you're feeling really tired and you're having a hard time focusing, you'll find yourself moving around, shaking your leg, trying to increase your level of alertness. And that's one of the functions of the vestibular system. Another really important function is the ability to coordinate the two sides of your body together. So think about it as a child, you're learning how to unbutton your shirt, you're learning how to zip up your jacket, you're learning how to tie your shoes. Those are all bilateral coordination activities, and those are all a function of the vestibular system. It helps play a small part in learning some of those skills. And then finally, the vestibular system is closely linked to our ocular motor control, our ability to really smoothly track and follow things through the environment so that we can look up to the board and see what's written there and then look down to our table and write the notes from the board. That's a function of ocular motor control, being able to control your eyes smoothly for functional activities. And that's also related to the vestibular system. So because of all of these skills and how important they are, this is something that we address in therapy, really looking to make sure that the vestibular function is working properly for your child. And if not, then we utilize that sensory integration framework to try to make some of those underlying changes to the neurological system to improve their function in balance and arousal and bilateral coordination and ocular motor control. So the next thing we're going to do is look at a video of children across the age span engaging in just typical vestibular play. So you'll get a feel for what do different kids at different ages generally do when it comes to vestibular interactions. Let's watch that together. Okay, so now you've seen what's typical play across the age span. Let's talk about what you can do if you think that your child has a problem with vestibular processing. Well, the number one thing you can do is go to your pediatrician and ask for a referral for occupational therapy evaluation. Go ahead and go into a clinic like Casa Colina and get seen by a specialist, and they can evaluate and see, is what your child experiencing typical, or do they need a little extra help? But besides that, you can also create a sensory-rich environment for your child. You can do all sorts of vestibular-based activities to help feed that system and help refine their experiences. So things like going to the park and swinging, getting those little sit and spin toys that they can sit on, or hanging a tire swing in your backyard. Trampolines are awesome for vestibular input. So don't be afraid to get a little mini tramp if you don't have a lot of room, or take them to the big jump houses, or get a trampoline in your backyard. Also, if you have a yoga ball or one of those, big therapy balls, you can get on it, you can bounce around, you can bend them backwards, you can roll around on it, so you can get a lot of vestibular input that way. But even just going for a walk or going on a hike, experiencing movement on a regular basis throughout your day, you really want to think about, how can I embed movement as an experience for my child multiple times throughout the day? It doesn't need to be a long time. You don't have to do it for hours at a time. Try 10, 20 minutes, go for a walk, go for a bike ride, pull them in the wagon, go to the park, swing on the swing. All of those things are going to help them to experience the vestibular input that they need to start to really develop those skills that we talked about earlier. So go, have fun, move a lot, laugh a lot, and we'll see you next time. Thanks for listening.